Our approach is very different. We want to treat the disease hypothyroidism itself. We want to increase the activity of the thyroid gland so that it can meet the hormone demand of the system. And we do not therefore do it with a hormone replacement therapy. We do it using our advanced homeopathic medicines, which aim to balance the endocrine system in a manner that is sustainable. In our case, the treatment has got a finite time within which the treatment is completed, because once the TSH reaches a normal value, the treatment is complete. Withdrawing our medicines do not therefore resort to again a disbalance in the hormonal imbalance in the system. What happens when a person comes for treatment for hypothyroidism to us? There are different scenarios. First is the simplest scenario, where a person has just been detected with hypothyroidism and he comes with a blood test which shows a very high TSH value. It could be just borderline high, like 6, 7, 8, or it could be very high, 50, 60, 100 TSH value. So in all these situations, we implement a treatment. We regularly monitor the thyroid profile. Let's say typically every 3-month intervals we do the blood test. We check the thyroid profile and we gradually see an improvement in the condition. Simultaneously, we also monitor any symptoms that the person may be exhibiting. This could be weight gain, this could be drowsiness, it could be insomnia, it could be any of these typical symptoms of hypothyroidism. And we provide our medication to make sure that he or she is able to have minimal symptoms while his or her TSH is gradually normalized to an acceptable range. Our treatment includes withdrawal of the conventional medicines. There is a process of withdrawing the conventional medicines. We have to understand the circumstances of the patient, and based on that we create a withdrawal strategy. That can be an immediate withdrawal, that can be a gradual withdrawal. There are processes in place in our system which enable us to actually do that in a very methodical way that is most beneficial to the patient in terms of the treatment. So gradually we withdraw the medicines. At the same time, after a temporary surge in TSH for a short period of time, it begins to come down. We allow the body to recognize the shortage of that hormone replacement therapy while our medicines try to stimulate the thyroid activity. Ultimately, what happens is, over a period of time, depending on the circumstances of the patient becomes independent of the hormone replacement therapy, continues with our treatment for a period of time, and therefore achieves a resolution of the disease hypothyroidism within a finite period of time, as opposed to a lifelong treatment. Why this is so important? Because hormone replacement therapies or agents that interfere with the endocrine system are a known and well documented cause for big diseases like malignancy. It is essential to pursue alternatives to hormone replacement therapy for hypothyroidism as one of the measures of reducing the risk of cancer in the general population.